Welcome, everybody.
Welcome, welcome.
Yeah, so good to see everyone and so happy to have you. Welcome to November, and this is our speaker series for the month. We're already well into our education sessions. We've had two Ask the Experts, if you can believe that, and now we are on our first speaker series. And another really good topic tonight, Aubrey. Thank you for joining me.
Oh, of course. I'm happy to be here. I'm excited because we were talking about this beforehand. This is my first, Hey sis, are you okay? But we've done some previously. So I'm excited to hop in.
Yeah. All right. So before we get started, um, Aubrey, how about if we start with our sponsors? We always want to thank them, tell them how much they mean to us, and they mean a lot because we do over 40 of these a year, and we couldn't do what we do without them. So our Her Speaker series, our education sponsors, our presenting ones are West, Merck, and Daiichi Sankyo, and we have support from GSK, Lilly, Gilead, Pfizer, and Immunogen, which is now a part of AbbVie. So a big shout out to them. We can't do what we do without that support, and we keep continuing to grow our speaker series, all of the different education sessions that we're bringing. So in 2025, keep an eye on us because we are growing some more of our education moments with you. So more to come, more to come. But thank you to our sponsors. We appreciate them.
And without further ado, I feel like this is a wonderful time then to bring in Cassandra and introduce her. So I will add her to the spotlight here so you guys can all see her. And I wanted to, of course, talk to you a little bit about her first. So Cassandra Bolding is a licensed professional counselor, substance abuse professional, HIV specialist, nature-based therapist, and PhD candidate. She's a global thought leader on implementing community-based approaches to destigmatize mental illness in the BIPOC community, enhancing gender equality programming, and promoting trauma-informed care. As an experienced program director, she's facilitated the training of more than 200 social service professionals, and her entrepreneurial journey spans 2 decades, resulting in international research, speaking, training, and consulting requests from around the world. Overall, she believes in individuals, families, and communities' inherent strengths, which allow them to participate in their own rescue. So, welcome, Cassandra. Thank
Thank
you.
you.
Yeah, it's so good to see you again. And yes, it is our third, right? Hey, sis, are you
Yeah,
okay? I love it.
yeah.
Thank
Thank
you
you
for
so much
bringing.
for the introduction. Thank you for all of you who have taken time out of your schedules to pour a little into you. That's so vital and important. Self-care as well as community care. And tonight we are community. And we are going to be together for about an hour. I usually say I'm going to do my little spiel. But if you have any questions, any comments, if you want to jump in and there's something that you feel that you want to say or some thought that you may have, please, by all means, raise your hand or put it in a chat. Sue and Aubrey are going to be looking at the chat for me. So that way, if any questions come in, any comments come in, I won't miss them. I always start by opening up and grounding us because the subject matter that we're going to talk about may be a little bit of activating for people as we're going through the discussion. So I want to make sure that we start everyone in a regulated place and that we're all grounded. So if you are able to, I'm going to invite you to put both feet on the floor or on the surface where you are. So if you're lying down on your bed, just feeling the weight of your body on your bed. If you're sitting down in a chair, just having your feet planted on the floor. And if you have anything in your hand, if you don't need it in your hands, just placing your hands on your lap, facing down so that you can ground. Give everyone a minute to just do that. And when we take our first collective deep inhalation in, I'm going to ask everyone to inhale through your nose and allow your stomach to fill up with air. Okay. So we're going to inhale and exhale that way. We're going to inhale slowly through our nose and we're going to exhale slowly through our nose. Okay. So I'm going to ask you to take your first inhalation in and Hold that breath. Just experience what it feels like to hold. And slowly exhale and release through your nose. And feel what it feels like to release. And just allow your feet to relax even deeper on the floor. Spread your toes out. If you're on your bed, spread your toes out on your bed. And let the weight of your body sink down into your chair, your bed, your sofa, wherever you're seated. And just feel the weight of your body on that surface. Feel the temperature of the room that you're in against your skin. Feel the texture of your clothing against your body. Be here now. Allow all your attention, your awareness to be here now in this present moment where you are safe and you're okay. Take a deep inhale in and bring all of your attention and awareness into your body, into this present moment. Hold that breath and slowly exhale and release anything that's outside of this moment, outside of the room that you're in. And be here now. Allow yourself to be present. I'm going to invite you for a couple more breaths. Just inhale deeply at your own pace and slowly exhale deeply. Bring your attention and your awareness back into your body. Bring a little bit of movement into your body. So maybe start wiggling your fingers, wiggling your toes. And when you're ready, you can slowly allow your eyes to flutter open and be present here in the moment. Thank you. So again, this discussion is, again, I want it to be as conversational as it can be. I really want to hear from you, and I want us to have an opportunity to have dialogue during this discussion. And so the title is, Hey Sis, Are You Okay? And I titled it that because a lot of times, either we don't ask each other, or sometimes we don't always answer when we're asked that question. You know, are we okay? Right? Sometimes we usually flippantly say, yes, I'm good, when we're really not. And so this is an opportunity, a safe space for us to have a little bit of dialogue about whether or not we're okay. And especially as it relates to the societal pressures and stressors that we experience as Black women, and especially Black women with breast cancer diagnosis. So we're going to go into the first slide and just kind of talk a little bit about what we're going to talk about this evening. So it's, the objectives for this evening would be to understand some of the societal pressures and stresses that, Black women experience with cancer, exploring factors that contribute to societal pressures and stressors, discussing the impact of societal stressors, pressures, and stressors on cancer treatment outcomes, and also highlighting strategies to support and for intervention. One of the things that we talked about in the previous Sis, Are You Okay? We talked a little bit about Black women, breast cancer, and we talked about depression. So in this particular conversation, we're talking about like the significant impact, like that cancer does have a significant impact on Black women's health, and that they have higher cancer incidence and mortality rates compared to women of other racial and ethnic groups in the United States. And some of the key stats on prevalence in Black women. So, Black women with a cancer diagnosis is limited, and Black women with cancer diagnosis is limited and be can vary based on various factors such as the type of cancer, stage of cancer, socioeconomic status, access to healthcare, and cultural factors. However, it is well established that cancer can significantly impact the mental health of individuals, and depression is one of the common psychological challenges faced by cancer patients, including Black women. And so, in our previous discussion, we talked more in detail about depression, and it's something that we can definitely, cover again at some point. But I just thought I wanted to, to mention it in this particular discussion. Although we're talking about societal pressures and we're talking about stressors, but we had to, discuss and explore depression as well as one of them. Next slide, please. So these are just some stats that breast cancer is the most commonly diagnosed cancer in Black women. According to the American Cancer Society in 2021, an estimated 34% of all new cancer cases in Black women were breast cancer. And as we note, Dr. Nia Bailey does a lot of work on with breast cancer, bringing awareness to breast cancer in younger women, and that women are being diagnosed younger and younger within the Black community. Next slide, please. So disparities in cancer incidence and mortality rates in Black women are influenced by various factors, including socioeconomic status, access to healthcare, genetics, lifestyle, and cultural factors. Addressing these disparities requires comprehensive efforts, including promoting health equity, raising awareness, improving access to healthcare, and conducting targeted research and interventions. I was so excited at the last Still Rise Farm event, where there is an organization that specifically looks at this very thing, which is research, conducting targeted research. And I feel like that's something that is missing, one of the missing links in terms of understanding the incidence of increased cancer diagnosis amongst Black women, and understanding causal and sustaining factors for it. So I'm really excited that research is now being done, and that targeted research is being done, and that more Black women are being encouraged to participate in research studies. And now there is an organization that is looking to ensure that more Black women are included in research studies, so that we have a greater clarity and understanding of how we specifically are impacted, as well as treatment and other strategies that are being utilized to support women during their cancer journeys are specific to our needs. So that's really exciting to me. But it's something, unfortunately, right now that there isn't enough of, which is also exacerbating some of the challenges as it relates to the disparities in cancer incidence and mortality rates. So inequities in healthcare system due to institutionalized racism are a leading cause of disparities in care among Black women. Next slide, please. So challenges unique to Black women with breast cancer, as I said, the racism, but medical racism specifically. So experiences of bias can impact mental health and create barriers to effective care. Health disparities, so higher mortality rates, limited access to cutting edge treatments, and limited support networks. And then community concerns, so family responsibilities, economic pressures, and social support challenges can heighten stress levels. So let me just circle back to medical racism. So when we talk about institutionalized racism, medical is definitely one that we see racism's implications. And one of the things that we talked about in the previous discussion was the fundamental mistrust for the medical system due to the historical context of experimentation, as well as the inaccurate information that was disseminated about Black bodies and their ability to withstand more pain, Black bodies and their the significant differences in Black bodies and how they are able to tolerate certain treatments or pain. And the inaccuracies have led to just barbaric treatment. And so it's something that has spawned the fundamental mistrust for medical systems, and also the treatment that Black and Brown women experience within the medical system. And then gender bias is another impact as well, and we'll get to that. And then just the community concerns, and that's another thing that we'll also explore a little bit, and hopefully we'll explore it in our dialogue once we open up the floor to discussion. Talking about the community concerns, I think, is a big one because we are indoctrinated in an individualistic societal structure. When, as Black and Brown people, we come from a collectivist societal structure where cooperative or community is very important. Working together within the collective is of significant importance and vital to our very survival, vital to our mental and emotional and physical health. So the community concerns is a big one because we value family. And as Black women, we are usually, whether we are in a partnership or not, usually the family structure is more matriarchal, where Black women are working full time, caring for the family, and are usually the people, like the go to people within the family dynamic. And therefore, it can be very difficult, during the cancer journey in terms of treatment, in terms of, juggling and managing all the additional responsibilities while, going through treatment. And, most of the groups that I facilitate, that has been the biggest challenge, is the very porous boundaries that we have within our families, and learning how to create healthier boundaries, so that we can focus on, our care and practicing, self-care. And community care is, definitely of importance as well as self-care. So being able to navigate those two things requires establishing healthier boundaries. And that's something that we'll talk about in the latter part, but I just wanted to make mention of that as well when, we talk about community concerns. Like that family responsibility piece is of great significance because in the women of color group that I facilitate on biweekly on Wednesdays, that comes up a lot, that I'm the person that everyone goes to. People don't know how to navigate or manage me not being okay. So I have to be okay. And so we'll talk a little bit about that. Like, how do you manage that? How do you, navigate the real time responsibilities that you have, but knowing that it's okay not to be okay, and being able to utilize and access resources that are going to be supportive to you when you're not okay. Next slide, please. So the impact of stress on health. So health implications of chronic stress. So stress can influence cancer progression, immune response, and mental health. And so those are some things that we can explore a little bit further in our discussion. I just want to be respectful of time because we do have maybe about 35 minutes. So I want to leave time for conversation. And the mental health and resilience. So we're going to discuss the importance of resilience, community support, and mental health care for long-term well-being. And that's something that I wanted to highlight as well in this particular statement. Culturally responsive mental health care is something else that I find has been of the most benefit, like when seeking mental health care. And we'll, talk a little bit about stigma as well. There's a lot of stigma, even though we have made, many more strides towards seeking mental health treatment. There are significantly more Black and Brown psychologists, psychotherapists, and other mental health providers than when I started about 20 years ago. And I'm grateful for that. And there are many more people that are seeking mental health treatment. However, there's still a stigma that is remaining within our community around seeking mental health treatment. And also, the access of culturally responsive mental health treatment is something else that's key to our success in treatment, and it being a benefit to us, like really being able to address the cultural aspect as well. Next slide, please. So mindfulness as a tool for stress management. So what is mindfulness? So mindfulness is exactly what we did in the beginning, like just fully being present and aware, being in your body, being in the moment without judgment. So not judging what you're experiencing in the moment, just being present with it. And so mindfulness can reduce stress, improve mood, and even benefit immune health as well. Next slide, please. And so, mindfulness techniques for managing stress, we kind of went through some of those. And I want to be able to do some of that once we are towards the latter part of our discussion. So, what I wanted to do now was be able to open up for conversation. So, if there are any questions, if there are any comments, if there are any thoughts that you may have, please, I open this up for you to engage in this conversation as well, because this is a space that was created for you. So, if anyone has any questions, if you have any comments, anything that you wanted to, anything that resonated with you, please, this is your opportunity.
Hi, my name's Alicia.
Hi, Alicia.
Um, One of the things that resonates with me or is of concern with me is the community piece that you spoke of,
Mhm.
and specifically for me, um, it's getting back to work after or and even during this breast cancer journey. Um, because what it seems like is a lot of employers are not as, say, sympathetic. Um, when you go through, let's say you're done with treatment and all of that, but there's that mental health piece that that might just take you a little bit longer, and how to navigate that. Um, and because there's the pressure, obviously, at least for me, to get back to work, but at the same time, you're not quite ready. So I'd like to kind of know if you have any advice or any thoughts on how to just deal with that.
Thank you very much for trusting yourself to trust us to share that, Alicia. And that's a very real concern, is like you said, the mental health implications, of it's a medical trauma. So when we talk about trauma, cancer diagnosis is a medical trauma. And just like any other trauma, we experience hypervigilance, which is just that heightened state of awareness, and also the hyperarousal, like the things that happen in our body, like the physiological responses to it, but also, like we talked about, the mental and emotional implications of it as well. And so, one of the things that Unite for Her has done, I think is such a beautiful provision, is having the biweekly support groups. And, the biweekly support groups I find have been very beneficial to the women who attend, because it creates community, and it creates a very specific and unique community in that everyone has a shared experience in the community. And so there are, many women who are in various different stages of their journey. So there are some women who've returned to work, and being able to have dialogue with them about like what their preparation process was for returning to work. What were some of the supports that they put in place for their return to work? And what were some of the things that they put in place after they returned to work? So being able to access, that type of support, I think would be great for you, Alicia. If you haven't already participated in the support groups, I would strongly suggest that, because they do have a women of color support group as well, and that meets every Wednesday at 1 o'clock in the afternoon from 1 to 2. And it's a great resource, again, because it gives you this type of environment every 2 weeks, so that you can come in and kind of talk to other women about what their experience was like. And there are so many provisions now that you may not know about. And so many of the women have accessed some of those provisions, and they can give you some suggestions about, what resources you can tap into to help you to prepare for your return to work, to prepare you for what, you may encounter if you're still treating during that time when you return to work, or if there are other things that, within your particular lifestyle that you may need assistance navigating or just processing. It gives you a safe space to do that in. The other provision that Unite for Her has created is having individual psychotherapy as well. So that's another provision that you can access. I'm on the listing. There are several other therapists within Unite for Her network that you can access to utilize for individual therapy, so that you can address some of those concerns that you have and just the implications of the medical trauma that you experienced, as well as, its impact, and so preparing yourself before, like what things you need to put in place, and not just logistical things, but what kind of supports you need to put in place. Like, who's your support team? Being able to identify who's on your support team that can help you in preparation when you do return and after you've returned to work, and kind of being able to utilize that entire um, support team. So inclusive of your support group, individual psychotherapy, but also the support within your individual community as well.
Oh, that would be great. Are there some links that you might be able to share, or just do I just go back to the website and look for that information?
Sue or Aubrey, if there's any support that you can, if there's a link that you could put in the chat, that would be awesome. And if not, if there's not something that you can put in the chat during the session, there's definitely, like you said, Alicia, like being able to go back on the website, because you'll be able to see under the services that they have to offer, the offerings that they have, you'll be able to find the support groups as well as the individual psychotherapy. And I mean, in addition to that, there are several, like when we're talking about like mindfulness and strategies for managing stress, there's yoga, there is Reiki, there are other types of like massage therapy. There are so many different resources that you can access, that you can utilize, which is why I was so stoked to participate with Unite for Her, because I am, a therapist, but I also have a holistic health center as well. And, thank you so much, Aubrey. Aubrey put it in there as well. Um, and then there's also the Still Rise Farms. Unite for Her partners with Still Rise Farms, and they have 1-day retreats as well. They have several 1-day retreats, but they also have a Women of Color 1-day retreat, where you're able to kind of access like things like meditation and yoga and other resources as well, just so that you can expand your toolkit in terms of ways that you can effectively cope and manage with these stressors, these very real stressors, that we're all experiencing right now. So I hope that that was helpful. And I saw that Aubrey did put that in the chat. So anyone else who has that, question, or who is thinking about maybe accessing those services, please, by all means, access those services. Unite for Her has quite a few of them as well.
Thank you. I appreciate that.
You're very welcome. Thank you for your question.
Yeah, Alicia, we too have a very robust library as well, and we've had a lot of stress-related sessions that you could go through under the speaker series, Ask the Experts virtual hangout, and find a topic that might feel like it resonates with you, and then watch that online at any time at your convenience. So everything from yoga, meditation. Again, this is Cassandra's third series, and then Aubrey put in the actual support groups. We have cooking webinars that are just, oh, it's just joyful. And Aubrey actually leads those as well. And it's amazing how these things can become support groups, even though it's a cooking webinar, right? Or it's a relief of stress. So feel free to look at any of those or attend any of our workshops as well, our cooking webinars, and Aubrey can put that in the chat too.
Thank you.
You got it.
Thank you.
This is your time, ladies. This is your time. This is your opportunity to chime in, to ask questions, to um, anything that resonated with you, to talk about that. I kind of moved really quickly through the presentation because I just wanted to make sure that you all had the opportunity to utilize this space. This is your time. This is a space for you to be able to share, to ask questions, to, again, like anything that resonated with you, anything that's on the top of your mind that you'd like to talk about. This is your space for that, and this is your time for that.
So this is Valerie again. Are
Mhm.
we asking questions? Yeah, are we asking questions on what you just spoke about, or just in general about our journey?
It either is fine. If you'd like to ask questions about what we talked about, like some of the concerns that related to like just the challenge, societal challenges and stressors, or if there's something, another question that you had that you wanted to pose, that's fine.
Okay. Well, I guess the question is because I was at on another wellness Zoom class,
Mhm.
and they were showing us and telling us how to check our breast. We should do it like once a month and on the same day so that we can remember it. But the instructor said something that really startling to me, and she said she had breast cancer in her collarbone. And I thought, wow, how can that happen? I thought cancer was just like in the fleshy part of your body, but I don't know. I just heard her say that, so I guess it can. So when we're checking our breasts, we got to go all the way up to our collarbones and check as well.
Mhm. Thank you for that point. Thank you for sharing that. I can jump back into the slide and I can finish out some of the remainder of the slides and talk a little bit more about different techniques that we could use, mindfulness techniques, and we were a little bit further along. Yeah. So we did a little. Sue, can you go back real quick? So we did a little bit of a breathing activity when we started, but 4-7-8 breathing is really where you're inhaling at the count of 4, you're holding that breath for 7, and then you're exhaling for a count of 8. So 4-7-8 breathing is really good with getting you regulated. So sometimes when you're activated, like by stressors, by different things that may be occurring, what can happen is that you're activated, and so your heart rate may be elevated, your breathing may be labored, you may feel that flush of heat, all those things that are indicative of being activated. And so using that 4-7-8 breath can help get you back into your body, back into the moment, and help you get regulated. You're actually stimulating your parasympathetic nervous system, that rest and digest response. And so that helps you get back in your body, back in the moment. So I usually try to incorporate really simple things that are helpful in just reducing stress in the moment and getting back into a regulated place. Things that you can use. Your breath is always with you. Um, Progressive relaxation is another tool that you can use where you just kind of go from the top of your head and just relax all the way down from the top of your head, down your face, down your neck, down your shoulders, down your body, like just kind of identifying this different parts of your body as you're doing your breath work. And that helps with just relieving the stress in your body that you're feeling in that moment. And so I'll do a little bit of demonstration like before we end of 4-7-8 breathing and then that progressive relaxation. So being able to take that, progressive relaxation and the body scan also, because we hold a lot in our bodies, like we hold trauma in our bodies. So being able to scan your body to see where you might be holding stress or you might be holding tension, in your body, the experience of anxiety in your body, where you're holding it in your body. So just scanning your body and checking in with your body as you're doing your breath work is so helpful in terms of just the physical, discomfort that you may be experiencing from your cancer treatment, but just also, the physical discomfort that we experience when we're activated. So when we're experiencing stress or we're experiencing anxiety, or any of those other things that we may hold in our body. These are some things that you can do to help with managing that. Next slide, please. Another helpful tool is practicing gratitude and self compassion. So, gratitude journaling. So, regular journaling helps to, not only clear the mind, but helps with being able to process thoughts, process feelings. I know for many people, women, when I am, facilitating the groups, a lot of times there are things that they want to talk about, that they want to process, but they don't always feel safe or comfortable sharing those things. Or they may feel like they don't have anyone that they can talk to or anyone that would understand what they're feeling. So instead of holding that, in, I always invite individuals to use a journal, like be able to get those thoughts and those feelings out in a safe space where you can say it exactly how you're feeling it. You don't have to curate it for anyone. You don't have to leave anything out. You can just allow yourself to express what you're feeling in your journal. And that helps with relieving a lot of the stress, anxiety, and other emotions that we're feeling. We can write them down in a journal. And, there's a lot of research that's been done on the benefits of journaling. Self compassion practice is another one. I find that we are our biggest critics and we are so hard on ourselves because we are the one that does the lion's share, of the support and of the holding space for other people in our lives. That when we are not able to either do that for others or we're not feeling okay, we can be very critical, of ourselves, especially going through this journey when you're accustomed to being able to do all the things for all the people and you're not able to do that. Sometimes it can be very difficult. And for many women, they can be very critical and hard on themselves, and putting a lot of pressure on themselves to get better and get better now, right? And be able to do the things that they did before. And so self compassion allows for you to be able to give yourself that grace, that patience, that tenderness during this time. The same things that we give to all the folks in our lives, being able to give that to ourselves. And as Black women, a lot of times we struggle with that because we've never seen it modeled for us. What does self compassion look like? What does self care look like? What does participating in community care look like? And a lot of times we haven't had that model, so we don't know what it looks like. So we're not able to incorporate it. So self compassion is such a huge piece. So being able to be, it sounds simple, being able to be kind to yourself, but it's such a powerful tool, in this, during this journey for many of us, because we aren't the kindest to ourselves when we're experiencing something that impacts our ability to do what we normally do. And sometimes we don't recognize ourselves, right? We don't recognize ourselves because we're not able to do the things we used to do. We don't look the way we used to look. So it's being able to have that compassion for yourself, being able to, you know counteract the negative self-talk, and being able to do counter messaging, because we have a narrative in our minds about what we're supposed to be able to do. And even during, a time as this, like when you're experiencing, the impact of cancer treatment and on your bodies, and still pushing forward and wanting yourselves to do things that in that moment your body isn't ready to do, like physically you're not able to do. So being able to have that compassion for yourselves during that time is so important. And so I thought it was important to list and to mention this one specifically in this group, because I find that many times when I'm working with women, especially women of color, this is an area where we struggle in terms of having that self compassion during this time. Next slide, please. Building support systems. So this is a really important one, as I mentioned before, that we come from collectivist societal structures. So we thrive in community. Community is where our strength lies. And so social support is so important. So deriving that social support from family, from friends, and from other breast cancer survivors. So Like I said earlier, the support group is such a great tool that you can utilize. But I think also family and friends. And during the time of supporting, facilitating the support groups, that's something that I've heard so many times over. They don't know how to support me. They don't know how to, provide what I need, so I have to provide it for myself. They've never had to do that, so they don't know how. And I've heard so many reasons why women don't ask for the support that they need or elicit the support from their family and friends. And it is an adjustment, and we talk about that in the group. We talk about the fact that many people's families and friends aren't accustomed to, being asked for support from, individuals, such as yourselves, myself. And so it can be an adjustment because they're not used to us not having all the answers, being able to do all the things. So giving them and ourselves the opportunity to adjust, right, to the shift in need, right? From them and from us giving and doing to us being able to receive. And one of the things that I always say when I'm talking to, whether it's someone that I'm working with individually or with groups, is that we feel that great joy, sometimes responsibility and challenge of all of, the support that we provide. But we also get the joy, right, from being able to love, lovingly support those that we care about. And sometimes we rob them of the opportunity to do that for us and to derive the same joy, right? And the same sense of being able to love and care for us as we do for them when we're not open, to receiving the support or asking for the support that we need. And so I think like this is such an important piece, that social support. How do you create social support when you're not accustomed to it? How do you access and utilize social support when you're not accustomed to utilizing it? And it starts with being able to have that dialogue. The support group, I think, is such a great segue into asking for that support in your families and, from your friends, because you're learning how to do that in the support group. And you're also being able to access the support of others in the group, and being able to learn what that feels like. It's almost like working a muscle, right? Learning what that feels like to receive that support, what it feels like to be in a space where it's just for you to receive, right? Because we're always in this posture of giving and doing. And very rarely are we in the posture of just being in a space where we get to have, our needs met and being able to ask for what we need, and us being centered in the care, right? We're usually centering, our spouses, our children, our, family members, our friends, as opposed to centering ourselves. And this gives you this, the support group gives you an opportunity to center yourselves in your care. And so community resources. So the support group, as I mentioned, is definitely also a community resource, but there are also different organizations that focus on Black women's health, as well as cancer support groups. So being able to access community resources is key in building support systems. And then online resources like what we're doing right now. And then there are also mindfulness apps and online support communities and websites for additional guidance. So these are like key in terms of building your support system, which is so vital right now, especially now going into the next year. How do I, have the support that I'm going to require during this journey, but also in addressing some of the societal pressures and stress that I have, building support systems. And this is key, like social support, community resources, and online resources are, just a few of the ways that you can develop a support system. Next slide, please. So just in summary, like just we talked a little bit about societal pressures and stressors, and cancer diagnosis among Black women renders a different set of circumstances. And we talked about what some of those are. And, due to like socioeconomic, societal, governmental, and institutional racism that permeates the systems that Black women must access during, treatment. And it's vital that immediately after diagnosis for their care, that being able to access these systems that are vital to their care, and all of the implications of, systemic racism on these systems. And so culturally responsive treatment options steeped in cultural intelligence is vital in rendering comprehensive treatment. So this is one of those resources, a culturally responsive resource that speaks specifically to some of the experiences that you have as Black women. And this is in no way an exhaustive, discussion about specific things that impact Black women. But it was, definitely culturally responsive in that we're talking about it. The opportunity is available for you to talk about your experiences specific to that as well. So I think like these types of conversations are so important. I know that although there wasn't a lot of engagement, I know that many of you are listening. You are acknowledging, in your own spaces what your experiences are. I hope that this is sparking your own thoughts, your own questions that we can explore in our next speaker series. So please, by all means, make sure that you post any questions in the chat, that you connect with us at Unite for Her. If you have any questions, if there's more that you want to cover, if there's something that came up for you that you wanted to cover. So this is an opportunity for any final thoughts or any questions that you may have. I want to open again before we close out our discussion. I wanted to just open the floor once more. I see that the chat is pretty active. So if you don't feel comfortable sharing in the chat in the open forum, you definitely can put questions or comments in the chat as well. And again, my name is Cassandra Ferguson Boulding. And if you would be so kind, Sue, if you want to put up just really quickly the last page where people can find me or find more information about me if they'd like. And I want to definitely, again, just open up the floor if there are any last words, any questions, anything that you wanted to add before we ended. And I do want to do like a quick meditation before we close out as well. But I just wanted to invite, if anyone had anything they wanted to offer, please, by all means, I am open and the floor is open.
Just wanted to highlight Valerie's comment in the chat. I know you're saying the chat's super active, and Valerie just said, so informative. She said, I feel less than, not myself, when I have to ask for help, and talking about asking family or friends to do things and run errands for her. She said, I've always been able to take care of myself, but sometimes I need help. I think that definitely, I'm sure, resonates with a lot of folks.
Yeah. Yeah, and that I think, with the support group, that is something that I hear a lot. Like I don't know how, it's very difficult for me to do that. I feel like I need to do it myself because either it's not going to be done the way I want it to be done, or, people don't know how to do it because I've always been the one to do it. And there are ways to navigate around that. And many of, again, the discussions in the groups kind of people talk about how do you do that? How do you access that support? How do you move beyond some of the things that you're feeling and be able to ask for that support while still acknowledging what you're feeling and taking care of yourself, like that. So going back to that self-compassion. So thank you for that, Valerie. I appreciate your transparency and sharing what you did and your vulnerability as well, which is something else that I think as Black women, we sometimes are challenged with because we've had to be so, strong, right? And the idea of strength and really doing counter messaging around that, like what is true strength? So thank you for exhibiting true strength, Valerie, and sharing and being vulnerable and being transparent and trusting yourself to trust us to do that in this space. Thank you. I want to honor that.
Hi, Cassandra. I'm not sure if you can hear me.
Yes.
Yep. My name is Michelle. As you see on the screen, I'm Michelle Medine Morgan. And I just want to thank you again and everyone here, just for the opportunity to kind of work through and think about all these things. And Valerie, again, you kind of helped me, I guess, find the strength just to kind of to just share a little bit about kind of what I've been going through, because this is all touching on the things that I'm doing to help, I guess, maybe navigate my new normal. My cancer journey is on the tail end. I just finished immunotherapy yesterday, so I got to ring the gong 3 times. I did my chemo gong, the radiation, and now immunotherapy. And the challenge, oddly enough, for me is now trying to figure out now what, because you said it, I think, earlier about this new trauma, and I didn't even realize that I'm probably going through some sort of post-traumatic type of thing, because now my fear has become, okay, how do I navigate life post this? How often will I get seen now? The frequency, the rate of recurrence. Like I've been hit with a wave of anxiety ever since approaching this date of now finishing, and so that's kind of just been the thing for me, finding the strength to kind of just like get through that the day, each day of just fighting through those thoughts. So a lot of things you mentioned, I've already kind of taken the approach as far as the mindful breathing and just looking for ways that the affirmations, all those things to try to just get through um, my day. But if there's anything else you could, I guess maybe uh, I don't know, anything to add to maybe what I could, add to that would be helpful.
Thank you for sharing what you did. Thank you. And I think, going back to some of the suggestions around individual therapy, as well as the support group space, and with understanding that this was a trauma, right? It's also being able to recognize that when you have an appointment, when you have a test, all of these things are triggering. So it keeps you in this activated state. And so being able to get yourself back into a regulated state is so key, because our brains don't know the difference between a real threat, a perceived threat, a past threat, a current threat. And so when we have experiences, especially traumatic ones, our brains store the information. It also stores the emotional response to it. So when we, like, things like you said, like things that are triggering, like tests, like doctor's appointments, like you said, like post, treatment, it's so anxiety producing because it is a trauma. And so your brain remembers when you receive that initial diagnosis, and so it stores that. So anytime you have a medical appointment or you have a test or you have to get test results, it's triggering. And so your brain isn't distinguishing the difference. Your brain just knows threat. And so it's treating you as though it's responding as though you're having an actual threat in that moment. And so all of the things that your body does to prepare you to either fight or flee happen. So that's why you feel your heart rate elevate, your breathing is labored, you feel that flush of heat in your body, you feel that tension in your body. Your body's preparing you to fight or flee, because it doesn't know the difference. Your brain doesn't know the difference between if it's a real threat, a perceived threat. Are we going to get news again? Right. So that's what your brain is processing in that moment. And so one of the things that I often suggest is, again, being able to go into a space like a support group where you can talk about those things on a regular basis, as well as working with a therapist, within a trauma informed environment, where they can help you with processing that, as well as identifying specific tools for you to utilize, to help you when you are in an activated state. And I'm glad that you are privy to some of the other, tools that we talked about. And I hope that you're incorporating them. And one of the things that I always suggest is incorporating those things daily. So incorporating breath work daily, right, throughout your day, so that even if you don't need it in that moment, you're rehearsing it. So when you do need it, it's automatic. And so you're able to, incorporate it in that moment. And you're not grappling, trying to find something to do because you've been rehearsing it. So using breath work, meditation, other tools like grounding tools, like being able to ground yourself. Also being able to utilize things like we talked about, like the meditation, like nature-based therapy. So nature-based therapy is a specific practice, but there's also being able to immerse yourself in nature, being able to take walks in nature. Nature in and of itself is very healing and grounding. How can you find out? So there was in the chat, Aubrey put the support group link in the chat, as well as the link for individual psychotherapy. And so those are two things that you could utilize. And then I'll make sure that I submit some more resources, specific resources, like maybe some videos or things that you can access and download that can be helpful in terms of 478 breathing and different grounding techniques, as well as what I demonstrated in the beginning, which is sound bowl healing, which is using frequency. So those are some additional resources, and that was an excellent question. Thank you so much. I'm trying to be respectful of time, but I really want for if folks do have last minute questions. Sue, do we have time to field a couple more questions if folks have questions or comments? Thank you all for being open, and you're very welcome for being open and to stay on and support
Yeah.
one another.
Yeah, I think too, Makia, I was sending her a direct message because I was wondering if she had a passport that was active as well.
Okay.
So,
That's
Makia, I will look that up so I can see that while
Mhm.
Cassandra's taking more questions. And I'll
Mhm.
be able to let you know.
That's right. And I'm going to also put some resources in because I'll, be able to provide some additional supports as well. So, like I said, I do have a holistic health center here in Philadelphia. I'm not sure if you're in Philadelphia or not, but I do have a holistic health center. But there also are a lot of virtual resources if you're not local as well on the website. So, as Sue said earlier, there are a lot of resources for stress reduction, stress management. There are a lot of resources as far as distance Reiki, distance yoga classes. I mean, there's so much that you can access that you can add to your toolkit. If there are no other questions or comments, I wanted to take us out and close out our group with just a little bit more of sound bowl healing and demonstrating that 478 breathing for you, and just to help us ground and to be in a regulated place before we end. So as we opened up our group, we opened up with our feet planted on the floor or on whatever surface they're on, our bodies being securely on our chairs, sofas, or on our beds, feeling the weight of your body. And we're going to take a deep inhalation through our nose. And this time we're going to inhale the count of 4. So inhale. And we're going to hold for a count of 7. And it's okay if you can't, but we're going to try to hold for a count of 7. And now we're going to exhale for a count of 8. So just keep letting the air come out of your nose. Good. And then you can inhale and exhale normal. And now progressive relaxation. So I'm just going to invite you to start from the top of your head. Just let that relaxation go down, top of your head down to your face. So letting your face relax, letting your eyes gently close if they're not already closed. Letting your jaw relax, letting your tongue go to the roof of your mouth. Letting that relaxation go down your neck, down your shoulders, down your back, down your arms, down your chest, down your arms to your hands, down to your fingers, just letting that wave of relaxation go down your legs, down your shins, your calves, down your ankle, And now down to your feet. Good. And take one additional inhalation in, a big inhale in. Hold that inhale and slowly exhale. And when you're ready, you can bring a little bit of movement back to your bodies, wiggling your fingers, wiggling your toes. And when you're ready, you can gently let your eyes flutter open. And I want to thank you for showing up in this space for yourself and for participating in the experience, whatever way you decided to participate. I'm just grateful that you were here. I'm grateful that you gave yourself this time just for you to be present in community and to be a part of such an important dialogue that focuses on you as Black women. I thank you so much for your time and for your participation. And again, there are opportunities for us to do this again. So please let Sue know, let Melissa know, let the Unite for Her team know what you'd like to hear more about, what you'd like us to have a conversation about in the future, and we will certainly make that happen for you. So for now, I bid you a good evening, and I hope that you enjoy the rest of your evening. Thank you.
Thank you so much, Cassandra.
Thank you. Thank you. And of course, our digital education events are presented by West, Merck, and Daiichi Sankyo with additional support from Lilly, GSK, Gilead, Pfizer, and ImmuneGen, which is now part of AbbVie.
Wonderful. Thank you, Aubrey. Thank you all for joining us. Please know that we have more coming up this month. We always appreciate you. We appreciate an active audience. We are community, right? And when I see that in people looking for community, please don't hesitate to use us as your community. We have many different ways and different areas that you may be able to align with and feel heard and seen and feel like it's helping you one step at a time. Another reminder, so Thursday, November the 21st at 1 p.m. Eastern Time, we have an Ask the Experts, so please tune in live for Unite for Her's Facebook page. And we are going to be joined with Shoshana Rosenberg, cancer epidemiologist, who's focused on research on survivorship, quality of life, and treatment decisions that are in young adults with breast cancer. She will answer questions about means supportive care for young adult survivors and thrivers. Of course, you can submit your questions at uniteforher.org/experts, at uniteforher.org/experts, all the way up until that time. And we will enter them live for you. All of our past events are always on our library, so please get in there and take a look. And again, you will see Cassandra in there now a third time. All right, Aubrey, thank you so much for being our co-host today. Always a pleasure.
Yeah. And I hope everybody has a wonderful rest of their evening. We'll see you soon.
All right. Good night, everybody.